you very rarely hear people talk about this, or in fact read in magazines or watch on YouTube. You very rarely hear about this.
Some people probably do deal with it that way, kind of make light of it, and there's nothing wrong with making light of it. Just make sure you don't ignore it because you're embarrassed about it or you don't feel comfortable going up. It can be lameness, it can be tail rubbing, it can be tension around the loins and croup, it can be kicking up at the belly, but nobody ever thinks it's regarding the sheath. You know, I see a lot on social media about, for example, on a group where people are talking about their horse tail rubbing and what's the best thing for using it, and you'll be recommended lots of lotions and potions, and I'm screaming out thinking, no, do a hygiene. It's most likely it's going to be that.
Oh,
you know,
gosh, all these unknowns, all these secrets, Allie, that are to be discovered. Do you feel a great sense of achievement, and do you feel that sense of doing rewarding, purposeful work, being a voice for our horses that can't tell us what's wrong?
How important is sheath cleaning? And are you avoiding a grubby job and neglecting your horse's health because you're embarrassed and a bit squeamish? Equine hygiene is a topic we generally avoid on the yard, isn't it? Well, because of the often awkward conversations about washing your horse's sheath. But Allie Macleod is the founder of the Horsebox Spa in the southeast of England, and she's on a mission to make change and open up the conversation. Allie is a British Equine Hygienists Association registered sheath cleaner and mare hygienist. And did you know that getting your horses cleaned and checked could save their life? It's not just grime, dirt and bean removal. A registered sheath cleaner is also looking for lumps, masses and abnormalities. Allie joins us now for a deep dive into equine hygiene.
Allie, welcome to Curious Equestrian.
Thank you so much for inviting me on. I'm really glad to be here talking about hygiene and horse health.
Now we're going to get into the nitty-gritty of it, Allie, but first of all, for those who don't know what we're talking about, what is equine hygiene?
Equine hygiene is, it encompasses the cleaning and health checking of the mare, gelding, stallion reproductive organs, I suppose. So we need to get them clean. We need to remove beans, but primarily the main purpose of a hygiene is to health check.
And for those who say, I guess you could call them skeptics, really, that say, well, horses live in the wild. Why do they need to be cleaned? Why do we have to get mares cleaned, geldings sheath cleaned?
I love this question because I get this all the time. So being able to address it here is just perfect. Okay, so if you imagine when we domesticate an animal, let's go back first. I hear this a lot, and my first response is, well, wild horses don't get their teeth done. Wild horses don't get their feet trimmed. Wild horses don't get their sheath cleaned or beans removed, do they? So when we domesticate an animal, we are responsible to take care of them, as they can't do that themselves as they would in their natural environment. So I suppose that is the main purpose. Horses, there is a misconception that horses self-clean. Well, they do in the wild, but when we domesticate them, that no longer happens. In the same way that horses, when we domesticate them, need to have their feet done, need to have their feet trimmed. You know, I hear that a lot, so it's a good one to address.
And is it the case because when we domesticate our horses, we mostly aren't breeding them? So is it to do with the fact that horses would be breeding naturally in a herd and therefore wouldn't need to be cleaned because their bodies are acting as they're intended to be?
Yes, exactly. So when a stallion covers a mare, they in a sense, they do self-clean by that very action. And beans don't get an opportunity to build up. For your viewers who don't know what a bean is, it's there is a cavity within the tip of the penis called the urethral fossa, and smegma gets in there, and it goes in. The hole is quite small. Let me just explain. It's probably easier if I give a little diagram because I do this with my clients. So if you imagine the head of the willy and the urethra runs through the center, just north of the urethra is a very small hole called the urethral fossa, and that is a big cavity behind it. So the entrance is very small, but there is a big cavity behind it, and that cavity takes up the head of the penis, or the tip of the penis. Now, smegma, dead skin, sweat, grime, it all kind of goes in there as almost like little bits of grit, if you like, so it can get in, but it can't really come out. So it goes in there, hardens and compacts, more comes in on top, hardens and compacts on top of that. And they end up over the months, years, forming these hard balls of smegma within the tip of the penis. Now, it's something that you can't necessarily see. Because it's actually within inside the cavity. Now, that cavity wraps around the urethra in almost like a kidney bean shape. Okay, so the urethra runs through the center and this cavity wraps around it. Now, as these beans get bigger, it ends up putting pressure on the urethra, which can cause pain, discomfort, and UTIs. If it presses on the urethra and your horse isn't able to pee or comfortably, or it just interrupts the flow, obviously they can get UTIs just as we would if we were to hold it in with ourselves. So, it's really important that we annually remove those beans for horses. Obviously, if we do it annually, the beans never really build up to be anything particularly big. So they're easy to remove without causing the horse any sort of discomfort at all, and before they actually cause a problem for the horse. Now, in the wild, when a stallion is covering a mare, the friction of covering a mare would dislodge the smegma, the build-up of smegma in there, all the rest of it, before it actually becomes of any sort of size. So wild horses tend not to really get beans. Stallions can still get beans if they are not covering mares. So domesticated stallions can still get beans as well. So unless we physically remove them for them, domesticated equine, they will build up. But obviously in the wild, when they cover mares, nature takes care of that for them. If that makes sense.
It's really interesting, isn't it? Because hearing you talk and hearing how important it is there that we take this on board when we have our domesticated horses and they're in our care, just as we look after every other aspect of their health. And yet when I think about my life with horses and how I've been around horses since I was young, and I've been around equines on livery yards and at riding schools and across the board, and I've owned my own and I have my own, and yet you very rarely hear people talk about this, or in fact read in magazines or watch on YouTube. You very rarely hear about this in terms of equine care, and don't you think this should be added almost to the list of teeth, farrier, vets, etc.? And yet no one's talking
so
about
frustrating. Yeah, it really is incredibly frustrating. So unfortunately, the importance of hygiene and sheath cleaning, etc., is not covered on any syllabus. It's not part of the pony club training. It's not part of the BHS. It's not included on any of the sort of like equine courses, whether that's a sort of like whether it's a degree or a diploma. It's not, the importance and how to do it is not covered by any of those subjects. And even up until the highest level of the BHS stages, it isn't covered. So what you find is, and obviously I work on professional yards all the time with sort of like BHS. One of my clients is a BHS fellow. I work with professionals day in, day out, and no one, doesn't matter how experienced they are as an equestrian, no one really knows how to do it correctly or why we do it. There is so much ignorance around this subject, and it needs to be discussed more about the importance and how it really affects a horse's way of going.
Allie, why do you think, why is it not deemed as important as the farrier, as the dentist?
Yeah, because it's hidden away. It's a forgotten organ. People, because they're not seeing it, don't think about it. If your horse, for example, was quidding and unable to, chew their hay, etc., the first thing you would do would be to call the dentist. A lot of the issues you see with horses originate from the sheath. So it can be lameness, it can be tail rubbing, it can be tension around the loins and croup, it can be kicking up at the belly, but nobody ever thinks it's regarding the sheath. They always think my horse has got pinworm, or my horse has just got a dirty tail, or my horse has got sweetish, because horses with poor hygiene or discomfort in the sheath, mares as well, will tail rub. And it's almost 8 times out of 10, possibly 9 times out of 10, originates from discomfort in the sheath, because the only way they can alleviate it is to tail rub or kick up at their sheath. Again, I hear about people all the time who they have physios out and chiros out, and there's always tension around that area of the back and around the loins. Can't quite get on top of it. Have a hygiene, because they're not fixing the root cause. Now, I'm not saying that this is the cause every time, but it's one of the most simple, basic checks you can do. It doesn't cost very much, and it will change your horse's world in terms of their comfort. People wouldn't think anything of spending 80 to 100 pounds, 150 pounds on a physio or a chiro, but go for the sort of like potential root causes first. And I think there's also not enough awareness about how poor hygiene affects a horse's comfort. So because the subject isn't discussed, and because there isn't that much awareness, and because it's hidden away, people just don't think these things are caused by the sheath. And very, very, very often they are. And this is why I love my job so much, because it's one way I can help horses. And I get asked all the time when I'm in yards, how did you get into this? And it starts off very jokey. You know exactly how I got into this, because we'll go on to talk about Angus in a minute. But changing a horse's comfort and seeing them go from uncomfortable to ride. And I've had a couple of horse owners who were looking at selling their horses because of behavioural problems, and it's because of the build-up of sharp smegma in the sheath. You give them a clean, and all of a sudden they're not bucking anymore, and they're not disunited, and they are not touch sensitive. So you can go and clip your horse round the sort of like inside of the hind, after a hygiene. Sometimes when a horse is really uncomfortable, you can't even put your hand in between sort of like the hind legs. They're very touch reactive, whether it's touching, grooming, or clipping. But after a hygiene, once they're brought back to comfort, you can then touch your horse there. So I've probably gone a little bit off subject, but
No,
yeah,
this is what we want
I
to
wish
hear,
more
Allie.
people, yeah, I just wish more people knew how much it affects the horses, because we're all passionate and we all want the best for our horses. And I want to help horse owners to help their horses. And for what a sheath clean costs, and it should always be done by a professional, you will change your horse's world. And they probably are telling you that they're uncomfortable. They'll be telling you they're uncomfortable by bucking, being disunited, kicking up at their sheath, tail rubbing, bum rubbing. I just wish more people knew what the symptoms were, and they got their horses done annually or twice a year.
There is so much to get into, Allie, but before we carry on deep diving, talk us through how you got into it, because I'm sure many people are listening wondering, how on earth did Allie become passionate about horses' private parts, essentially?
Yeah. Okay, well, this is a subject so close to my heart. So I wasn't aware when I first started doing hygienes that this was a business or a service that people offered. Okay, I have always done my own horses. I kind of, obviously I know so much more than when I first started. I started off like everyone else, going to YouTube, looking at videos on how to do it. Almost every video you see on how to hygiene a horse on YouTube is not correct. So people are getting incorrect information from the internet. Okay. But I've always cleaned my own horses and removed their beans. It was something I just taught myself. I put a glove on one day, went up into the sheath, and then before I knew it, I was almost arm deep, and I was horrified how far up you can go. But so that was quite by mistake. And then after that, I kind of learned how to do it. So I've always done my own horses. Now, back in 2018, I set up the Horsebox Spa, and my core services were bathing horses, etc., etc. So I was the Horsebox Spa. And then COVID hit, and I, like many people, wasn't able to work. And it was the first COVID lockdown. And it was my friend was a bit concerned about her horse. She'd had him for about 4 years. He was only 11 years old, and she'd never sheath cleaned him. And she was a bit concerned. So she asked me if I would clean him. And although it wasn't a service offered to clients, she was a friend, so I was more than happy to help. Anyway, as it happened, I wasn't even able to get my hand into the sheath because he had about 4 large masses blocking it. So I referred her to the vet, and her vet diagnosed him with melanomas, and they were so aggressive, so advanced that they had to not only remove the penis, but they also had to remove the entire sheath as well. Now, it had already spread to his abdomen and his limbs, but he was able to go in and get everything removed, and he now lives with us, and he's 5 years on. He's I wouldn't say it's cancer free because obviously it has spread to his limbs, but it no longer bothers him, and he's living a really normal life now. Our friend who is who you also know very well, Annie, it's her horse. Like most horse owners, I think even if she had put her hand in the sheath, because we don't know what the normal is up there, the average equestrian doesn't, she probably wouldn't even known if she had tried to sheath clean him that was an abnormal mass, which were indeed melanomas. And I have to say that to this day, I have never come across melanomas like that in any horse, and especially not one so young. You might find that in a slightly older horse in their 20s where they're quite so large and aggressive, but at the time he was only 11 years old. Anyway, that hygiene ultimately saved his life. Identifying it and sending him to referring him on to vet. So ultimately it saved his life. And I'll go back to the COVID situation now. So Horse and Hound picked up on that story and did a large article on it. And I guess it was because it was such a large operation, and they just mentioned me for finding the mass, or identified that there was an abnormality. And I was inundated by clients asking me to come and sheath clean their horses and to check them over. Now, I had done no marketing on it. I still wasn't even considering doing this as a business, but I had about 60 inquiries just in my first month.
Wow.
Obviously, I do a lot more now, but that was just 60 sheath cleans without even advertising it.
Wow.
And sheath cleaning, as I've always done my own horses, it's never given me the ick. I don't find anything at all about the horse disgusting. To me, I feel like as a horse mum, it's just something I need to do to keep my horses comfortable. So I decided that, do you know what? If I can play a part in helping to find an abnormality, obviously you never want to find them, but if I can play a part in finding an abnormality that might just save a horse's life, or at the very least, bring a horse back to comfort and the removal of excess smegma and beans, then I would be happy to do this all day long. And my business went from one concept to something entirely different because of COVID. When I diversified, it changed my business completely.
Wow.
And I would sheath clean all day long. I never get tired of it. I love working with horses. And I would say that now probably I keep detailed records on every single horse I treat, so that when I go back, I've got notes on what I found previously. And, hopefully horses are all absolutely fine. But what I'm finding is, because my clients, I've got about a 75 to 80% repeat business rate. People have me back every 6 months, 12 months. And, there are many cases I've had where horses have been normal in the first, second, third year. And then I found a slight abnormality. And some of the abnormalities you'll find regarding cancers are so subtle. It could just be a tiny rough patch of skin, smaller than my little fingernail on the tip of the penis. I will always refer to vet. Very often they turn out, I'll send them to the vet to diagnose. I'll just want to make clear that I don't diagnose anything. Only a veterinary surgeon can by law. But I do know what the abnormalities feel like. And very often they're very subtle, which is why you need a professional who really does know how to health check. Sometimes it's just a small rough patch of skin. and that can turn out to be an early stage skin change. Very commonly, most often it is. There's no other reason to have a rough patch of skin on the tip of the penis or on the shaft or anywhere like that. So it's usually always a skin change. Now, by finding these abnormalities so early on, what we're finding now is that the treatment is less invasive. Back in the day, it would be either to have the penis partly or fully amputated. But now my clients are finding that because we're catching it early, they can have it lasered. This is so much, one, cheaper for owners. It's less recovery time for the horse. It's less invasive. And, so that just goes, to show that you just really shouldn't underestimate or the importance of health checking. I find that roughly 1 in 10 horses I treat has an abnormality of some description. Okay, that doesn't mean to say it's anything sinister like a cancer. I would say that probably 1 in 100, maybe less, maybe 1 in 80. Sometimes I might go a month with not seeing any, and then other months I could find 2 or 3 with a skin change. But yeah, I'm finding that it's roughly, if you average it out, roughly 1 in 100 with a skin change that is potentially a squamous cell carcinoma or diagnosed later on by their vet as a squamous cell carcinoma, a very aggressive penile cancer. Now, there is been research into this by a top veterinary surgeon. He's a Europe-wide renowned equine oncologist, and I believe he's done research into this, between the link between these squamous cell carcinomas and geldings, because in the wild or breeding stallions, these cancers are not that common, but unfortunately it's not uncommon at all in a gelding. And I believe that the cause of these cancers in geldings is by the buildup of excess smegma, which causes microabrasions on the skin, which causes lesions, which can then turn cancerous. So for those reasons, good hygiene is critical to horses' health. So this misconception that people aren't doing their horses any favors at all by saying, my horse doesn't need to be done, horses take care of themselves, don't interfere with what goes on up there. It's it's not fair on the horse, and it's not their fault, because they probably heard this. People, when I was younger, we didn't interfere, we didn't know. But also back in the day, we didn't know about kissing spines and ulcers, did we? But through social media, back in the day, we put it down to being naughty ponies, and they'd probably be passed around, the little buckers we all had when we were younger. And then you would kind of say, well, he was just a naughty horse. That horse is probably bucking because he's either got kissing spines or he's got ulcers. We have to have a better understanding about how hygiene affects a horse as well.
This is how dangerous, isn't it, Allie?
Yeah.
These ideologies that spread
Yes.
through riding school and liveries is so dangerous, because essentially it's just someone potentially in a position of power. If it's a yard manager, or it might be an instructor, or it might be a parent, whoever it might be, saying, oh, don't interfere with that, or haha, they're just a bucking pony. It's it's not only spouting something that's very incorrect, but also it's reassuring everyone that that is fine, that's normal, we don't interfere up there, it's all natural, we leave it be, or that is a bucking pony and it's just its personality. And suddenly it's reassured, it's sunken in, and everyone around thinks, oh yeah, that's absolutely fine,
and then they pass it on to the next
day.
person, and they pass it on to the next person.
Yeah.
Yeah.
And
that's how. Yeah, and so it carries on, and it's so wrong, and we need to start changing attitudes and mindset towards that area of the horse, and to take away the kind of grubby connotations, around that area. Oh, it's disgusting. Oh, I couldn't do that. Oh, do you see what I mean? We're horse mums at the end of the day. We have to take care of our horses. And if I would always say get a professional in any way, because primarily you want your your health checked and to remove the beans. And that's something that your average equestrian, is something you build up over doing hundreds and thousands of horses. You build up this experience. And as a horse owner, you don't get an opportunity to do it that often, because it's only really a once or twice a year job to kind of really know what is normal and what's not. So you should get either a professional like myself or your vet to do the hygiene once a year.
And isn't it interesting? Ali, the language that you're using in terms of saying horse mum in this scenario, because it's something we talk about on the podcast, and we certainly have done before, about, you know, do we use the term owner, or are we caregivers, are we guardians, are we friends? How do we describe that relationship with our horse? And actually, horse mum in this regard is such an important term, because as a parent, you don't avoid the private parts of your child in terms of caring for your child when they're a baby and they're young.
Yeah.
You embrace the health of your child, and you have open
Yeah.
conversations with your child as they grow. As a horse mum,
Exactly.
to avoid that area, because oh no, we must, you know, we don't go up there, we don't look, we don't check, is
Yeah.
actually is going against the idea of parenting the horse, isn't it? It's part of the care of the
Yeah.
animal.
Yeah, exactly. I mean, when I do thousands and thousands of horses, I hygiene, and there's nothing sexual about it. It is just part of the horse. When I'm dealing with that area of the horse, it's no different to dealing with their leg or their ears or whatever. It is just part of the horse. So Pete, you should not kind of, just because yes, it's a penis, giggle. It's kind of, so what? Your horse needs that sort of care. It's a horse mum. It's something that has never ever icked me out, and it's just part of the care that they need. So I think it's a lot of sort of, I think also the grubby kind of connotations around sheath cleaning. It's also, referring it to derogatory terms like willy washing. It takes away the the not the seriousness. You can't get too
Yeah.
serious about a job that I
No,
do.
but I
Let's
know
face
what
it.
you
We
mean.
can't
It
get too.
does. If
Yeah,
you just say,
yeah,
you know, ha ha, snigger, snigger, you got to willy wash your horse, it
yeah,
does sound a
yeah.
bit cringy. It
It
sounds
does.
silly. It sounds
It does.
jokey,
It
doesn't it?
sounds a
And
bit
it
grubby.
sounds
Yeah.
a bit awkward, and like there's
I,
some sort of awful joke in there somewhere, doesn't it? Rather than actually,
yeah.
it's
And
life saving
some
for the
people.
animal.
Exactly. And if it's not life-saving, it's going to change their world in terms of their comfort.
Mm.
So, yeah, I mean, some people probably do deal with it that way, kind of make light of it. And there's nothing wrong with making light of it. Just make sure you don't ignore it because you're embarrassed about it, or you don't feel comfortable going up there, because it is a hidden part of the horse. It's not just cleaning the little external part of the sheath that you see, the pouch that hangs down. We do have to go right up and inside. And a lot of people would not be comfortable going up. And I hear this a lot. I would do it, but I just don't know the anatomy. And that's, I wouldn't want to hurt my horse, or I wouldn't want to do it wrong. And, that's important as well. There are people who would want to do this for their horses, and they don't find it sort of like funny or sort of like embarrassing. They genuinely would want to do this for the horses, but because everything is hidden away and there is no training on it, and it's very difficult to show someone how to do this unless you basically just self-train, how to do it correctly. So there's different sides. There's a case of some people are just would love to learn how to do this to take care of their horse, but they don't know how to do it because there is no training, because there is no professional qualifications in sheath cleaning. It's not part of the syllabus for any of the pony club, BHS, equine degrees, diplomas. It's just not part of any of it. And in fact, I'll tell you something that might surprise you. I've actually got a couple of vets on my books who I sheath clean for. Now,
Really?
I always ask the question, why don't you do it yourself? You're a vet.
Yeah.
And they have both come back with, it's not on the veterinary syllabus. How to hygiene, conditions of the sheath, absolutely. Yeah. Diagnosing, treating, all the rest of it. That is on the syllabus, but actually how to hygiene, remove beans, etc., is not. And I think one of my other clients as well said that for her to be able to sheath clean her horses, she has 5 of them, she would have to give them all a sedation so that they drop, because that's how a vet would do it. A vet would sedate. I don't know why. That's possibly to do with insurance purpose reasons, but also as they're a vet, they'd probably want everything out so they can examine it. But yeah, so from right down at the bottom to right up at the top, it's not taught anywhere. At
It's
least it
really
wasn't on the syllabus a
interesting.
couple of years ago.
I mean, that is a
Yeah,
shock and it is a surprise, and I think I won't be the only one listening to that who thinks, "Wow, you would think it would be on the
yeah,
syllabus by now." But also,
yeah,
talking about our mutual friend Annie, who has her horse Angus. It was at the time back in that pre-pandemic life, when Annie told me about what Angus was going through, that I had just chills sent through my spine when Annie said, this is what's been found. She was obviously distraught, she was worried, she was anxious of what was going to happen, but how she'd had your help to find out and to discover what was going on. And she knew that I had 2 miniature horse geldings, and she said, you know, is this something you do? And I said, no, you know, got aghast and shocked and thinking, gosh, you know, I've had them since they were foals, and I've not had this done. And obviously then I was spooked and scared, but I was also so thankful to Annie for kind of opening up and sharing her journey and her horrors at the time that she was experiencing, and her urging me to get in touch with a sheath cleaner to also make sure that my horses were okay. And I thought, isn't it interesting that it takes a big story, a big shock to actually for the ripples to then go through the equestrian community. It isn't something that is discussed just in the tea room on a livery yard, or, you know, in the auditorium of a
Yeah.
riding school, or whatever it might be. And at a similar time, just before Annie had talked to me about this, a friend on a livery yard that I knew mentioned briefly to me, she just said sort of gung-ho one day, she said, oh, because, you know, when you have a gelding, you have to sort of just go up there and just sort of give it a bit of a hosing out. And I said, oh, what do you mean? And she said, well, I just sort of, you know, I just sort of have a go, you know, a bit of washing up liquid or whatever, a bit of shampoo, and just sort of a bit of water. Oh, you just make sure he's nice and clean. And it was that sort of attitude that I think you're getting at, Ali, that actually, do you know what you're doing when you are tackling the issue? If you know your horse needs to be clean and cared for, do we know what we're doing? Or are you actually just taking matters into your own hands to save a few pennies?
Yeah, it's trust me, it's not worth saving a few pennies on a hygiene. When, you know, yes, you know, obviously if the willy comes out, people think that, you know, if they just sort of like take off the crust, etc., that's their horse has had their willy wash. Well, effectively, yes, but that's only a fraction of what it is we do. You know, we've got to clean the sort of like the external part of the sheath that you see that hangs down. We then have to clean the internal area of the sheath, which is right up inside, which is where the penis sits when it's not been extracted out. We have to remove beans, and we also have to health check. And you know, what you really need is a sheath cleaner or a hygienist who takes the time to get a horse very clean, so you can feel everything. If there is any excess smegma still left in the sheath, any crust at all left, or dead skin left on the penis, then you just don't know what is them and what is muck. So I mean, I take, you know, probably longer than most to sheath clean, because it's not that I'm slow, but I am really thorough. You know, even a pimple in the sheath, I would find it. Even a tiny little patch of skin that's slightly rough, I would find it, you know. So it's really important, you know, unless you get everywhere really, really clean, you cannot properly health check them, or thoroughly health check them. And it's just not worth it. You know, you'll probably be lucky, but if you're one of the 1 in 100 horses or 1 in 80 horses where I find these skin changes in, those are the lucky owners. You know, I've lost count now. 2 of my clients went in to have surgery last Wednesday to have squamous cell carcinomas removed. One was a tiny little patch of rough skin, and the other was actually, he was my client, but I didn't get to him in time. He was booked in, and 2 days before I went to go and see this horse, the lady cancelled and said that she'd had to have the vet out as an emergency. She'd only had the horse for a week, and the horse was out in the field, and he dropped his penis, and there was a tumour the size of a plum off the end of it, and she'd only had him a week. And so she went in to hospital. So they were both squamous cell carcinomas, and they both had them removed on the same day at the same hospital. But, you know, going on, just sort of like, just go off subject a little bit, it's really important that people get their horses health checked even before they buy the horse, because I hear this quite a lot of that people have had their horses a short time and then we find abnormalities up there, but it's not part of the 5-stage vetting. So obviously, if you're looking to buy a horse, it's very much worthwhile asking at the same time. You'd have to pay a bit extra from the vet, but asking them to also hygiene and health check the horse internally as well, because, you know, that one lady, I mean, bless her, she's only had the horse for a week and she had him straight into hospital to have the tumor removed. It was enormous. She sent me a photo, but that wasn't picked up on the 5-stage vetting. But he's very lucky that he ended up with her, because she's obviously, took him straight in and had him treated and had that surgery done for him, and he'll go on, I'm sure, to live a very normal life. They do cope incredibly well with the surgery.
It
It's a big
seems to be an
operation.
area of horse health that we're really, and I say we as a big generalisation across the equestrian sector, that we are really failing our horses in. It's
We are
not on the
failing them.
veterinary training.
Totally.
It's not on the 5-stage vetting. It's not talked about at livery yards and riding schools. Before we delve into that more, Allie, take us back 6 years ago when you were inspired by Annie and Angus, and you'd been through what you'd been through with Annie and Angus's journey, and you had so many calls, you were inundated. How did you then go about training, and was it a job role in the equestrian sector that you could plant yourself in, or were you one of the first few that were to start this in this industry?
So after after everything that happened with Angus, I then was inundated with requests from clients to go and check their horses out as a result of the Horse and Hound article, where it became public knowledge. And but I knew how to sheath clean, but I wasn't a trained professional. So I obviously practiced on my own horses. I practiced on all of my friends' horses, and one of my friends actually owns a riding school, and I asked her if I could go and practice on all of her horses, including the mares. I always did my own mare as well, but it's always good to get experience with different horses. And I basically self-trained. I spoke to a top hygienist over in the north of England, and I just said, look, I'm looking to do this, and this is the reason why I want to get into hygiene. Are there any tips you can give me about going pro? I'm not in your area. I'm not going to be competition for you, but I want to do this right. And she was amazing. She told me all about what products to use, how to do it. She even sort of like gave me the heads up on some of the abnormalities I should be looking out for, even the very, very subtle ones, and what they would feel like. So yeah, she was a bit of a mentor for me when I got going. And I'll never forget the time she said to me that to be really skilled at bean removal, she said, you're not going to really be skilled in it until you've done your first 100 horses. And I think that's true. Taking the beans out, it's all right if they're small, but if you've got a bean that's goes almost like the width of your palm, and some of them have been enormous, they've gone across all 4 fingers. And it's like, how do you get them out of a hole that big? That takes skill that you don't hurt the horse or even tear the urethral fossa. Horses are going to be incredibly uncomfortable. You get kicked daily, sometimes twice a day, depending on how many horses you're doing. And not twice a day, 20 times a day, because we can do an awful lot. So it's a pretty dangerous job. So it's a case of I spoke to this top hygienist. She gave me some hints and tips on how to get going and how to do it safely. Basically, I'd also spoke to a couple of my very close clients, people who I had used me quite a few times before, who I knew were friendly, and asked them if I could sort of like practice on their horses, also at the riding school. And that's basically how I probably did about 20, 30 horses for free before I finally had it's really just been a case of just building up experience. Like every horse you work with teaches you something different. You have to be, when you're working around the back end of the horse, you have to get a rapport with the horse. You never go straight there and get straight to work. I mean, I suppose I am typically a horse mum, and I do treat all horses a bit like, babies. They need babying, especially in that sort of area where they might have a degree of anxiety being touched there if they haven't been touched there before, or if they've got anything in the sheath area that's causing them pain and discomfort. You have to so I never go straight in. I'll always spend a few minutes with the horse first, never with my gloves on. Horses see blue gloves and they instantly think you're a vet. So you go in there, get the horse comfortable. I always have a feel around the inside of the hind legs, stroke them down the belly line, make sure they're comfortable with me touching them, and then we begin. But yeah, no, you learn different techniques for different horses, where to stand, how to do it, how to remove beans. Every horse is different. But it's a really dangerous job, and it's not for the you can't back off when a horse necessarily starts kicking, for example. I mean, I wear kick guards as standard on my legs. That means that when I am being kicked or cow kicked at, you know, they can kick me, but I don't feel a thing. And it sounds quite violent because the pads are plastic and it sounds really violent, but it's fine. And it means I don't lose my nerve. And if I can still stand there at the back end and not back off, then the horses then get more confidence from me and they soon settle. They soon settle.
I was going to ask you how you keep yourself safe, and wearing kick guards. It's interesting that you almost feel like you need to justify it, but what a sensible idea. You know, don't we need to up our kit and protection in the equestrian industry when we are working with dangerous animals?
Yeah. I mean, horses' legs make contact with my legs often. I think I have got quite fast reflexes as well, and I know where to stand so that I don't get kicked. I've got my way of cleaning where I find that I'm in a really, even when they cow kick, they almost always miss me. Um, but it's harder when you've got a bigger horse. So if you've got a 16.3 plus horse, they've got longer legs, and I have to stand that much closer to their hind legs in order to be able to get up, and they tend to have a sort of like much longer internal part of the sheath. So it can be dangerous, but you just need to know how to confidently, very calmly handle the horse. Never get cross with the horse. It upsets me when I have clients who have said they've used someone else before, and that the person was,
Mm.
how do I describe this? They shout at the horse, or no, I'm not saying all hygienists do, but I've heard a couple of stories where clients have been upset by having sheath cleans in the past who were maybe a bit. So and it just wouldn't even cross my mind to shout at a horse or be cross or to be firm with them. I think it takes quiet, confident, calm handling.
And that's where your horsemanship comes into play. You know, you're not only the hygienist as a service, but you have to use your horsemanship skills to interact with the horse and keep the horse calm. Because this is an area, as you've pointed out, that is one that we avoid as owners. And vets, farriers, trainers, instructors, no one goes near that area, so you are maybe sometimes the first person to interact with that area, and it is going to be a fright, it is going to be a shock, isn't it, for the horse? How do you reassure the horse and kind of communicate that it is okay to let
I talk to them all the time. I talk to them all the time. I find that also when I'm looking out for little micro what's the word? Behaviors. For example, a bit of a tail swish. I never take my eyes off the tail. I never take my eyes off the hind legs. It just takes a bit of maybe just changing their weight on their back feet. I know when a kick's coming, but also I've got one hand inside the sheath. People will very often find me stroking the back of the horse's of the leg with this hand. One, I find that personally that helps to soothe the horse and reassure them, but also I can feel when a kick's coming. So, it's all these things. I just talk to the horses non-stop when I'm sheath cleaning. I try and soothe them. I soothe them with the other hand, just stroke their legs, and most settle with me. I won't say I can treat them all, but it's very, very, very unusual that I need a horse to be sedated. You know, there have been horses that I haven't been able to treat. Sometimes as a professional, you have to just know when to cool it. When a horse is getting itself really worked up, it's just not fair on the horses to continue. And at that point, the owner just has to get a sedation. Yes, it's a cost, but it needs doing. But I will always do my best to try and treat a horse without sedation. Like I say, it's very rare. I might need one horse a month that might, or and then some months I might go 2 months without a horse needing to be sedated. And when you think of the hundreds I do, then it's it's significant. I think I'm pretty good at doing most horses.
you've got to be your own champion, and certainly
I
you
like to
are,
think I've
Ali.
got skills. I've got skills,
And I've got to
and I
ask you,
know a lot of
because
techniques as well.
the industry has been rapidly changing. You have now been in equine hygiene for 6-7 years, Ali. How have things been progressing since you first started, and what's changed within equine hygiene over the last few years?
Yeah, well, I've been going since 2020, so I think I've been going about 5 years now. And a lot is changing in the industry, which is something I'd really love the opportunity to talk about. So, when I came in to the industry, there were a lot of, I suppose, willy washers, if you can describe it as that. It was my vibe from the industry with it was a little bit grubby, a little bit kind of jokey and a little bit grubby, and it was, willy washing, if you like. But my experience with Angie and subsequent other clients, and I see a lot, I felt that that it needed to be more of a kind of respected and professional service. It needed to become more of a profession. We needed to set standards around this service, um, to yeah, it basically, I felt that the industry was lacking governance, regulation. There is still no real regulation, but it was definitely lacking governance, standards, code of conduct, and training on health checking and not how to sheath clean necessarily, but it's definitely lacking understanding on how to do it correctly, what products to use. So whether you're doing it yourself or whether you've got a professional, I'd love to talk more about that. But yes, so anyway, so I joined forces with a number of other of the top hygienists, I suppose, in the country, with my kind of passion for wanting to make sheath cleaning more professional. And so we set up the British Equine Hygienist Association. We launched that in 2023. With the objective of setting industry standards, a code of practice, ensuring that all of our hygienists, or all hygienists, we can't talk for all hygienists, but we know that all of the BHA hygienists are fully insured. When I say fully insured, I mean care, custody and control, not just third-party liability. The most important aspect of being a hygienist is having care, custody and control. And it's not covered as part of the standards grooms policy. It's an endorsement. And since we launched BHA back in 2023, the insurers in the City of London, because it's all underwritten by the syndicates in London, they sat up and they changed their policy to only insure BHA approved hygienists because of the sort of like all the processes we have to mitigate risk. So what's the risk? We all have to do a risk assessment and submit that, but also we work to a very strict code of practice. We are all fully insured and CPD trained regularly and attend CPD lectures with veterinary professionals as well on health checking. We're all really experienced at health checking, but it's really good that our members keep up with that training once a year with top veterinary professionals.
How has it made you feel, Allie, to now have BHA in action? How has it changed your working life and how you feel about the industry?
Yeah, I'm just so grateful to see that there are changes within the industry, and that I suppose don't work with, we're all our own independent businesses, but to see so many like-minded sheath cleaners and mare hygienists come together and saying we can see the industry, there are poor standards, poor practices, and downright dangerous practices that we see going on in the industry. And we want to make a change, and we want people to sit up and change people's mindsets about hygiene and get the message out there that this is primarily a health check for your horse, and it will also improve their comfort and their performance and their way of going. It's an area that you can't ignore. So to come together with that group of, I think there's about 14 hygienists now within BHA. It's not an association that you can just join by paying a fee. Like, for example, with the British Grooms Association, I think it's something like £25, and you can join and you can kind of self-certify. With BHA, we are very kind of protective of the brand. We're doing it for the horses, we're doing it for the owners. So the hygienists that come into BHA we know are fully insured. We know they've been trained by veterinary professionals. We know that they work to incredibly high standards, and they comply with biosecurity and hygiene practices, etc. And also, they're incredibly experienced hygienists. We don't take on sort of inexperienced hygienists within in BHA. And the reason for that is I think we've got hygienists in most territories now, but we want to be the one safe place. So if you, for example, wanted to get your miniatures hygiened, it's like, where would you go? How do you know who is a good sheath cleaner? How would you know who's reputable? So by coming to BHA, we've already ticked all those boxes for our members. You know that when you come to BHA, you will get someone who complies with the law, who is a either a limited company. We're a professional business, for example. They're not all limited companies, but we all kind of do our taxes, we run our businesses professionally and not a side hustle, if you like. And that we are trained and we are experienced at health checking. So when you book a BHA hygienist, you're getting the very, very best hygienist that there is. So hopefully take away the worry and stress to equestrians of, how do I choose someone reputable? Because the problem is, because people don't know about hygiene, people will recommend someone to their friends, but how do they know they're good? We see all the time sheath cleaners, shocking as this may sound, that don't wear gloves. Now, not only is that quite disgusting and unprofessional, but it's also putting horses at risk of cross-contamination, venereal diseases. So there are some, we hear also of sheath cleaners who will put on a pair of gloves, but then go from horse to horse. So they're not changing gloves between horses. So, but these people you still see get recommended on Facebook and they still get reviews, and people just, yeah. So BHA is basically the safe place to go to. We're going to be hygienic.
And Ali, what would you like to see as we move forwards? You talk about wanting to raise awareness, to spread the word, but what will it take, do you think, for things to change, for people to communicate? And for us, I say us, but for those who feel a bit squeamish about the whole thing, how do you think we're going to make those changes in the equestrian sphere?
It's difficult. I think we need to start with youngsters coming in, the equestrians, start at Pony Club. You don't have to teach, the kind of 8-year-olds how to sheath clean, but it can be as part of one of their tests, about why we do it, because they can't clean like they would in the wild, and how do you do it? Well, you would book a professional or ask your vet to do it. It's that sort of thing, and then build it up from there. And then from the Pony Club, build it into the BHS syllabus. Absolutely, it should absolutely be part of the diplomas, equine diplomas and degrees as well. It's no surprising it's the one part of the horse that pretty much most equestrians, I really haven't come across anyone really who knows sheath cleaning and the anatomy up there and how to do it correctly. They're just, you know, it's amazing to think of all the knowledge out there with all the equestrians, but it's the one enigma, if you like. No one really knows. They think they know, but they don't really know.
And I love that you mentioned the young equestrians, because for those listeners of Curious Equestrian who haven't watched our documentary called Think Like a Pony, go and check it out. We filmed at a brilliant equestrian centre in Yorkshire who are doing things really differently to traditional riding schools, and it's all about natural horsemanship, and it's about the bond between child and pony, and it's about introducing groundwork so that it's not all about the riding and how they're performing and what they're achieving and competing. It's also about giving children the chance to do groundwork. And I think, wow, how incredible that kids are going to actually have that choice of how they want to work with horses as they grow up. It's not that you then just start lunging because you've bought a horse 10 years later and you think actually you should do a bit of rehab, or it's gone a bit lame and you want to see how it's moving. Actually, you've got the choice to have a passion for groundwork and that become part of your equestrian life from a young age. And what you've just mentioned, how fantastic, but also how fascinating to see that shift in equestrian knowledge change, and that these youngsters would grow up and now will be able to grow up if the education changes, knowing knowing what horses need, you know, and actually having that level of understanding of, yes, you need the farrier, yes, you need the dentist, and yes, you need your equine hygiene, you know, checked every year or every 6 months, as you mentioned.
Yeah, and also, you know, to learn what the symptoms are. And so when people do have issues, you know, I see a lot on social media about, for example, on a group where people are talking about their horse tail rubbing and what's the best thing for using it, and you'll be recommended lots of lotions and potions, and I'm screaming out thinking, no, do a hygiene. It's most likely it's going to be that. You know, if your horse hasn't got sweetage but it's rubbing its tail and bum, most likely it's hygiene. You know, obviously it could be pinworm and there could be other causes, but go with the hygiene first because that's most likely going to resolve it. So, you know, it's kind of people understanding what the symptoms are. And I think that even from a very low level, from maybe I say the low level, so, you know, you can go up to the A and B test within the pony club, but from the entrance level, from when kids first get involved with horses, I think they need to be aware of it is a job that needs to be done once a year for horses from the age of 5 and upwards. And these are the sort of symptoms, you know, where you would need to speak to your vet or speak to a hygienist if your horse is displaying these sorts of symptoms, and start it from there. And because we need to get rid of this sort of the misconception that is currently being the misinformation that is being spread. So we need to start so that the youngsters coming into the industry now can start spreading correct information and start challenging these outdated views, old school views.
And mares are just as important, Allie, as geldings. You've mentioned a few times throughout the episode. Why do we need to remember our mares within this conversation as well? Why do you think mares get forgotten about in terms of this sort of conversation?
Well, I suppose the mares have always suffered with discomfort in that area. But I think the difference is with the mares, everything is, some people may incorporate a lot of the hygiene already as part of their grooming routine. You know, the mares get similar buildup of dead skin and sweat and oil secreted that kind of congeals between their teats. And sometimes, you know, that can be almost like it's sharp and it can be as thick and as abrasive as like a tree bark between their hind legs. So you imagine as they're walking along, that's sore for the girls. So again, they buck, they tail rub, they're disunited when they strike off from behind into canter. So, you know, but I think a lot of people do take care of most of a mare's hygiene themselves. And if they don't, I would say it's definitely worthwhile checking your mare between her teats. Be aware that if she has got a crust build up there, most will cow kick if you touch it. So you never just pick it off. You need something to soften it first, like a lube, a water-based lube. But yeah, a lot of people don't realise that mares get beans as well. I'm not sure I'm allowed to say this, but mares get the beans inside the clitoris. So again, it causes them real irritation. It'd be like having grit in your underpants, in your knickers, and yeah. So again, we shouldn't be forgetting about the girls as well. You know, it's a bit different, I suppose, the mare hygiene to the boys, and the fact that, you know, the beans that the boys get can block a function and cause UTIs and real issues. With the girls, it's more of an irritation. But we don't want them to sit there and rub and be irritated all the time when it's something that's so easy to resolve. So yeah, don't forget about your mares, especially if they are showing all the kind of typical signs of discomfort. Get them checked out as well. And actually, I've come across a couple of times mares where they have been tail rubbing because of hygiene, whether it's a bean or whether it's the other crust. We always do it. We don't do any internal cleaning with a mare. That I just want to point that out, okay? But we do have a little internal look for, again, to health check. We're looking for lesion on the vaginal walls or around the vulva area. A couple of times I've actually found splinters inside the mares. And why? Because they've been, yeah, you can just imagine that. And no one, obviously, you'd never think to look inside your mare, open up and have a little look inside there. Just, but if they have been tail rubbing on a tree or, you know, on a stable wall, they can get splinters in there. So I've come across that twice now.
Oh
Yeah.
gosh, all these unknowns, all these secrets, Allie,
All
that
these
are to
unknowns.
be
I
discovered.
know.
Do you feel a
Yeah.
great sense of achievement, and do you feel that sense of doing rewarding, purposeful work, being a voice for our horses that can't tell us what's wrong.
So yeah, I actually find the hygiene. So obviously I offer a couple of services or treatments with the Horsebox Spa, but I have to say every time I get a sheath cleaning booking coming through, they're the ones that I more than anything love to do. And people probably find that quite funny how passionate I am about hygiene, but there is nothing more rewarding for me than bringing a horse back to comfort. And something that would never otherwise have been found. And whilst my heart sinks every time I find an abnormality, not all of them are sinister, but when you do find some abnormalities up there, whilst it makes my heart sink, just knowing that I've been able to help a horse get earlier treatment, from the beginning, earlier referral to their vet to get diagnosed for then treatment, is that's rewarding too, because ultimately it can save your horse's life. If everything is hidden away, very often with some of these conditions, by the time the owner notices something that's gone on, blood, lumps, for example, tumors, it's just almost sometimes it's too far gone. So it is, I suppose, I don't know if rewarding is the right word, but it's I'm just grateful that I can help horses in that way by finding abnormalities early on and get them over to their vets for treatment. So yeah, it's a very rewarding job, and I just love being able to help horses, and yeah, I love it. And I'm probably the most passionate sheath cleaner I'll ever come across. And yeah, we've just got to move on from the kind of grubby connotations, the embarrassment that surrounds the subject. There's nothing to be embarrassed about. Like I say, there's nothing sexual at all about it. It's just part of the horse. There is nothing, in my opinion, that is disgusting about the horse, and not even that area. So that's probably what makes me such a good sheath cleaner, is because
and it's very inspiring.
it is what it
and
is.
The way how relaxed you are rubs off on us, and then it makes us feel comfortable talking about it. And thank you for that, because that's enabled us to talk
Pleasure.
on this podcast today, because you are so chill and you are so cool about it. And it makes even me, who thinks, I don't want to say the wrong thing, it makes me feel, relaxed. So I'm sure you've inspired many listening to the podcast.
I hope so.
Today. Thank you
I
so
hope
much.
so.
For
Go
those
get your horses
listening-
checked.
For those listening, how do they find you, Allie? If they want to find out more, if they want some reassurance, if they want you to come out and give their horses a check.
Okay. Well, I only cover Kent, Sussex and Surrey. So if they want to book me, they can go to my website, which is thehorseBoxSpa.co.uk, and all my zone dates and my diary is on my website, along with the online booking form. It's really easy and quick, so they can book me that way. If I don't cover your area, but you want to get your horse checked, I would recommend that everybody goes to the Behaviour website, because there should be a list of a hygienist in your area. And we're all trained, insured, very experienced, and we are, we're just, you're gonna get a professional if you go through Behaviour. So the website for that is behaviour.org.uk. That's beha.org.uk.
Allie, thank you so much for coming on. You're going to stick around and you're going to answer some burning listener questions for our exclusive members only podcast. So we're going to get to that in just a moment. But for now, thank you so much for coming on Curious Equestrian. It's been amazing.
For having me, and thanks for letting me talk about this subject. I really appreciate it.
Thank you so much for listening to and watching Curious Equestrian. If you enjoyed this episode, please don't forget to subscribe to us on YouTube so that you don't miss an episode and all that's coming your way, or you can subscribe to us on whatever podcast platform you listen. If you could leave us a review on Apple Podcasts, that would really help us to find lots more lovely listeners. And you can also follow us on Instagram @Curious Equestrian Podcast. We'll see you next time.